name is Cheryl Fazulis, and I'm president of the Foundations at Rochester Regional Health. And this is a Facebook Live today outside. I'm happy to be joined by Cindy LaVitro, a colleague of mine for years. Hi, Cindy. Hi, Michelle. Cindy is the Chief Nursing Officer for Long-Term Care, and we are here today in Hillhaven, and we're doing a couple things. And we'll get to what's happening behind us in a moment, but I first, Cindy, want to start with you. So we're here today celebrating deaths. But this is a bigger part of something else going on at Rochester Regional Health this week. So can you talk a little bit about what Health System Week is all about?
Sure. Health System Week is really a way to recognize all of our employees. We do have employees that are here 24 hours a day, 7 days a week. And we don't always get to step in and say thank you to the staff that are doing all of the work behind the scenes. From our environmental service workers to our physical therapists, occupational therapy, our doctors, our nurses, which is Nurses Week also, so happy Nurses Week to all of our nurses.
Happy Nurses Week, thank you.
And, our environmental service workers, they are working so hard right now to try and keep everything clean for us. It really is about the food service workers preparing meals for the patients that we serve. So we really want to make sure we take the time this week to recognize everyone.
And I think that what I struck by this year and so in years past is that while we celebrate everybody in the health system, I think what you just said is really so important. As we watch the donations come into our health system from the time that COVID began, so much is focused on the frontline caregivers, and there's so much work that goes on behind the scenes, like you said, food and nutrition, environmental services. Excuse me, and these folks are doing the same amount of work, just different work every single week. So this is the time we celebrate all of that.
It is, and we've really had great response from folks who maybe their areas of work have diminished in the volumes of work that they have. They've actually come and helped the long-term care facilities out. They're doing jobs today that they never thought they could do. We may be having, somebody who's working at a screening table taking a temperature, and that's not normally part of their job. So we really appreciate them stepping in to help.
Yeah. It's been amazing what we've been able to do for redeployment during this time to give people opportunities to learn different things. So let's just talk a little about Nurses Week too. So as you just said, happy Nurses Week, but Nurses Week is also a celebration of nursing across the health system. As some of you may know, this year the World Health Organization designated this as the year of the nurse and midwife. So we're here celebrating nurses also, of which you happen to be one. So what made you want to become a nurse?
So really just from 7th grade on, working in the nurse's office at school was kind of the trajectory forward. So
I didn't know that.
That was also a great way that I was starting college. So, I just had great opportunities to go to high school in order to go to nursing programs. And I've always done long-term care. It's always been my favorite thing to do. But when we talk about Nurses Week, it's not just about the nurses. It's about the unit assistants. It's about the certified nursing assistants. All of the nursing support staff, they work in the nursing department. So we call it Nursing Week to make sure that we recognize everyone.
That's really important too. So let's talk about what's happening behind us. So we're joined today by Chloe Smith. Chloe is an artist who is sharing her talents with us and drawing something inspirational for our employees. So Chloe, you can stay right there.
Yeah.
We're going to talk a little bit really loud though. Talk a little bit about why you chose what you chose.
I wanted to choose something kind of uplifting and inspirational. As far as the theme, I thought maybe, like a bluebird and springtime and some symbolism there. And just, something to do with nursing and healthcare with the club. And, just something bright and colorful for people that are walking into work and maybe they're tired, they're kind of downtrodden and need something bright, in their day. So, yeah.
It's absolutely beautiful. And I just really got there. I thought that looked like a hand, and now I know that that's what you were
It's
doing
like a
with the
rubber
glove.
glove.
Yeah, it's beautiful. It's really beautiful. So do you do this all the time? Is this sort of a...
Not all the time. I kind of do it freelance here and there. Depends on events and festivals and things that are going on in the area. But I try to do it, during the warmer months. Usually, so it was kind of chilly, but it's getting warmer now.
Well, it's beautiful. Yeah, thank you for sharing your talents with us. Thank you so much. And while we're talking about generosity, because Chloe donated her time, I want to spend a moment with Cindy because I know you're familiar with all of the support that we've gotten from the community. It has been overwhelming, the amount of generosity and support that has been out of our health system since COVID began. Talk a little bit about what you've seen.
So we have had people donate masks. So for all of our patients and residents, we are providing them with a mask, but it is because of donations from the generous people that we serve in the community are really kind of reaching back and doing something special for us. The food donations, our staff is sometimes working, 12 hours a day. They don't have time to go home and eat at night. So for them, this could be the only hot meal or even a sandwich that they may have. So the generosity of the community to give back to our employees has just been really overwhelming. You see the staff grabbing that lunch for the day, and you can see what a difference it made for them.
Yeah, absolutely. And I want to extend a thank you on behalf of the health system and the foundation to the community for the outpouring of support. We have, from Clifton to Newark to UMMC to Unity to RGH to our long-term care facilities, had just an outpouring of donations, as Cindy said, of PPE, of hand-sewn face masks, of which one I'm wearing. So whoever made this, thank you. I absolutely love it. I get tons of compliments on it. And the amount of food that we have gotten to feed our employees has been unbelievable, as well as thousands and thousands of dollars in cash donations to Rochester Regional Health to offset what we're experiencing with COVID. So I know you and I are both extremely grateful for what that has provided to the system. So thank you for joining us today, Chloe. Thank you so much for sharing your plans with us. Really happy to be here. And Cindy, again, congratulations on Nurses Week. Thank you for everything you do for the health system. And we look forward to being with you guys in the next Facebook Live. So have a great day.